We are the largest emergency department in South Texas. We see more than 80,000 patients a year. We are a level 1 trauma center. We have over 400 intrinsic staff to the emergency department, which is augmented by all of our specialty surgery, pediatric medicine services as well. From Austin to the border, we are the largest emergency department, followed very closely by University Hospital. Less than 3% of the patients that we see are civilian, and the majority of those are the trauma patients that come in. We're part of the South Texas Regional Advisory Committee. University and us, the two hospitals, split and share trauma in South Texas to help the more remote locations that don't have the trauma services for care that's needed. The emergency department is about 400 people. That includes Army, Air Force, Navy physicians, nurses, medics, administrative personnel, civilian that are GS, contract as well. When it comes to trauma, the trauma surgeons and emergency medicine physicians and anesthesiologists and orthopedics, all the folks that render the majority of trauma care, we meet together monthly and have a committee meeting, and we actually have committees and procedures and processes so that we're all on the same page. Because an approach to a trauma patient needs to be systematic and done every single time. So we follow the same American College of Surgeons rules that civilian hospitals, civilian trauma centers have, because those have been proven to decrease any missed injuries and provide the best care. So we do it in a multi-disciplinary team approach. Trauma is important wherever you are. In the military, it is an absolutely critical aspect of our mission, because the way we train here is what prepares us for when we are in Afghanistan, Iraq, the Philippines, wherever the case may be, and your son or your daughter or your family member is injured. We need to train here, which is the doctors, the nurses, the medics, the surgeons, the anesthesiologists, the emergency medicine physicians. We all have to come together, and we get to practice our craft here on critically traumatically injured patients, so that when we get there, wherever we are, we're prepared to work as a cohesive team to help save that life. We are the only level 1 trauma center in the Department of Defense.
Really?
That's part of the reason it is so critical for us to maintain our status and do this. So we have Navy, Air Force, Army, physicians, nurses, medics, Special Forces trainees. They come here to either be trained full-time, like they just finished their initial training and now they need special training, or when they've been out doing it and they need some refreshers, this is the place they can come to get that experience, to reintegrate and practice with the team, teach each other, and then be ready to go downrange. Many things go into having a level 1 trauma center. A large component of it is you have to have a certain amount of volume. If you only see 5 patients a year, you can't do it. And you have to have that volume because you need all the specialties: ear, nose, and throat, ophthalmology, trauma, neurosurgery, critical peds, critical care medicine. So you have to be at a facility that has enough patients daily and enough emergency patients to keep all of those specialties busy. The military, like every other part of the government, has a cost, and so we need to balance the health care that we give to everybody and the training that we need. And so you can't, the middle of Idaho rurally doesn't have a level 1 trauma center, and the same could be said of Fort Sill, Oklahoma. If you don't have the troops or the injuries there or the people, you can't have them all over the place.